Thank you for the invitation to talk today, and thank you to our moderators. So I'll be discussing today the future of wearable technology in female sexual dysfunction evaluation and management. Now, my disclosures include that I do not treat female sexual dysfunction. However, I am very interested in non-invasive diagnostics and at-home monitoring in sexual health. And as such, I'm doing a study with FirmTech. And as Dr. Mulhall was referring to, we're actually looking to compare it to penile duplex ultrasounds. So that'll be an interesting thing. But they do have a device that is in the works that I will be discussing today called Clitique. So there's very little information about what are standardized things we can use for evaluations of female sexual dysfunction. I'll go through here some things that can potentially be used, but haven't really been looked at very thoroughly as far as specifically for female sexual dysfunction. So one that has a little bit more is sensory testing, which includes thermal and vibration sensory analyzers. And that could distinguish certain causes of dysfunction. For example, related to prolapse, they found some reduced sensation, things like multiple sclerosis or other neurological diseases. Pelvic floor EMG or clitoral EMG has also been shown to potentially, in certain situations, be related to female sexual dysfunction, such as for dyspareunia with pelvic floor tonicity. Clitoral Doppler ultrasound is, like in males, potentially helpful, but not in standard practice quite as much. We'll talk about that as well, specifically with female sexual dysfunction. There's also been looking at vulvar, vaginal, clitoral photoplethysmography, which is like pulse oximetry. And the thought there is it may represent the overall blood flow to the female organs, but it's been shown to be more relevant when we're comparing arousal versus not in one patient, as opposed to differentiating different causes of female sexual dysfunction or somebody who may have certain causes versus others. Other potential things are thermal imaging cameras, laser Doppler images, galvanic skin responses. I'm not going to go through all of these in detail. There's dozens and dozens. For example, functional MRI or PET scans, but not super relevant when we're talking about wearable technologies overall. So pelvic floor EMG, as I talked about, is fairly unclear as far as its role in female sexual dysfunction. There's some studies that show that dyspareunia may be associated with higher pelvic floor tonicity, and another study that showed that poor pelvic floor coordination, as well as increased fatigue, may be seen in female sexual dysfunction. But a lot more is needed to really understand what that means. Duplex ultrasound, when we're looking at baseline versus arousal, there appears to be changes in clitoral diameter and the systolic velocity and diastolic velocity of both the corpus spongiosum and the clitoris itself. And some of these things that we see in the duplex ultrasound, such as resistance, may be associated with cardiovascular risk, so even beyond female sexual dysfunction, it could have overall health implications that would be good for patients to know. And so if they can find these things out at home, then that is a lot more information they can have for their overall health. The one thing that I was able to find that there was differences in between patients with sexual dysfunction versus not is in those with provoked vestibulodynia. So at-home options, as far as treatment goes, at-home biofeedback is something that's been looked at by a number of different companies. Biofeedback is pretty well established as far as pelvic floor muscle dysfunction, and there's a number of different available devices. So this is mostly for pelvic floor strengthening, less for something like vaginismus, but the basics are there. I think it provides an opportunity for patients to use these technologies at home at a more comfortable place than having to go into an office. So things that are potentially in the future of female sexual dysfunction include this clitique device, which is a wearable monitor. It's positioned below the clitoris, and it can measure clitoral engorgement. It's also planned to have other different monitors like the pleth or bioimpedance sensors, and it can be worn overnight or during sex to potentially find more information, much as the male devices are potentially able to, as far as spontaneous clitoral erections, nocturnal clitoral erections, and can likewise potentially provide some prognostic information or treatment information as far as overall sexual health. There's also, we had talked about the vaginal and vulvar pulse amplitudes as potential information sources, and the thought here is to look at blood flow. I didn't see too much that was recent as far as vaginal or vulvar, but there was a fairly recent 2020 pilot study that was looking specifically at clitoral pulse amplitudes for this kind of device. Now, overall, there was a pretty weak correlation. There was a lot of potential things that could have affected this, like positioning of the device. Each of the participants' anatomy is potentially a factor as well. There is this Lioness Smart Vibrator. So it's a typical vibrator, but also has a phone app where it can measure pelvic floor contractions and at the same time can give some information about changes over time as far as responses to sexual input. Vibratory stimulation has also been shown to be pretty helpful from the female sexual dysfunction standpoint. Now, this device is more limited in that it's not exactly meant to be long-term wearable. It's not necessarily designed for overnight wear or during the day, but still provides a lot of interesting information. Now, as far as wearable treatments of female sexual dysfunction, this is been around for a while. It's the Eros clitoral therapy device, which was cleared by the FDA in 2000. So there were a number of studies shortly thereafter looking at it. It's had a few studies that showed increased sensitivity, increased ability to achieve orgasm, increased vaginal lubrication, as well as improvement in sexual satisfaction. And there were some studies that looked at hemodynamics as well on ultrasound and did show some improvement overall, although it was not comparing necessarily to people without it, but compared to baseline. So could potentially be helpful as a potential wearable in the future. And these are my references.